Awesome. It's live. Welcome, everyone. My name is Niti, and I'm the owner of Back to Basics Functional Nutrition here in Dallas, Texas. This is my first episode going live with a guest of mine whom I'm going to introduce just in a minute. The purpose for doing this live interview series with a practitioner from our functional medicine, from our integrative medicine world, is the reason why I'm doing this is because most of us, we grew up in a around conventional medicine world. And I know so many people who are looking for answers and they just don't know where to go. So there are other in my functional medicine world and my integrative medicine world, there are so many other answers which you are looking for. So be it IBS or thyroid issues or diabetes or cardiac health. So that is the reason we are doing this live series. And so if you are catching this live, you can put your answers, put your questions in the chat below, and we'll be happy to answer at the end of this session. And if you are watching this as a replay, put in replay in the comment section, and that will really help us with the algorithm on these platforms. Okay, without further ado, let me introduce a very dear guest of mine, Dr. Ovadia. Dr. Ovadia is a practicing heart surgeon. He has a very busy schedule, and we missed him yesterday because he was busy saving life. Yesterday, he had an emergency surgery that came up that he had to perform. And not only that, he has authored a best-selling book, Stay Off My Operating Table. Yes, guys, I know many of you are looking for answers for your heart health, for your metabolic health. Get it ready because we are going to get some great conversation today. Dr. Ovadia believes that optimal metabolic health is the key to preventing and treating chronic diseases. And his mission is to optimize your metabolic health and help you stay off his operating table. Dr. Ovadia has also practiced cardiothoracic surgery in Beaver, Pennsylvania and Clearwater, Florida, and has established Ovadia Heart Health in 2020, where he now works as an independent contractor. And if in an effort to overcome his own lifelong struggle with obesity, Dr. Ovadia adopted a low-carb way of eating in 2015. And he has lost 100 pounds. And not only that, he has maintained weight loss of that 100 pounds, which is so hard these days. People lose it, but they gain it back. And so he has extensively researched these health benefits of low carb with a focus on heart health. And so he's here today to share with us his journey and his knowledge with all of you. Welcome, Dr. Ovadia.
Hi, Niti. It's so nice to be here with you, and I'm glad we are finally able to to record this. They say the third time's the charm, and it seems to be for us.
Yay! Awesome. Doctor, why don't you start by telling everyone your journey, what you do, and how you went about doing this?
Sure thing. So my background is obviously in the, traditional allopathic medical world, and I have been a cardiac surgeon, a heart surgeon now for close to 20 years. And during much of that time, I was becoming progressively unhealthy myself. I had gotten to a point after struggling with obesity my entire life that I was morbidly obese, I was pre diabetic, and I realized that I was going to end up on my own operating table, so to speak. And I was really at a loss of what to do because I had tried everything I had learned in school, all of the advice that I would give my patients: eat less, move more, eat a low fat diet, count your calories. And these things were failing me and were failing my patients. Thankfully, I started to come across some different ideas about why we get unhealthy, why we get obese. And ultimately, I was able to, you know, overcome my battle with obesity. And along the way, I came to realize what was going to help the patients that I saw every day with advanced heart disease. And ultimately, what I've come to recognize is that every patient that ends up on my operating table is essentially a failure of the medical system. And it's not that the patient failed, it's that the medical system failed the patient, because these patients follow the advice that they're given, taking the medications, eating a low fat diet, and yet they still end up with advanced heart disease and end up on my operating table. And what I've now come to recognize, and what I hope to continue to educate people on as much as possible, is that the real key to avoiding much of the chronic disease that we suffer from, including heart disease, is with paying attention to and optimizing your metabolic health.
Wow. That's awesome. So your personal health struggles help you create the practice that you are doing now. And so that you are trying to save everyone and hoping that everyone becomes metabolically fit such that they are not going to land up on your operating table. That
Yeah,
is awesome.
ultimately, I want to be a lot less busy of a heart surgeon, and I want to help as many people, to get this information that will keep them off of the operating table.
Yes. And you want to be busy spreading the word. So I guess that is what you're doing right now. Thank you for doing that, doctor.
Yeah, I mean, I am blessed. I feel blessed to be a heart surgeon and to be able to offer that service to people who are in need at the time that they need it. But ultimately, what I have come to realize, once I knew this information, once I saw this information, I could not unsee it, and I could not keep it to myself. And just while I have a very comfortable life as a heart surgeon, I'm very busy. And I certainly could just go on and finish my career doing just that. I would not be serving myself, and I would not be serving my patients to the best of my ability. And ultimately, that's what a physician's mission is. That's what a physician's purpose is to do what is best for their patient. And no matter how good I am as a heart surgeon, no matter how good all of the heart surgeons out there are, no patient is as good after the heart surgery as they would have been if they never needed the heart surgery in the first place. And so the more that I can do now to educate people how to avoid advanced heart disease and avoid chronic diseases like diabetes and high blood pressure that end up leading to heart disease, the more that we can do that, and the more people that we can now keep off of the operating table, that is how I will ultimately measure my success.
Yay. Awesome. Doctor, so many of us are curious and they have questions. Most of us, when we go to a well check or doctor's office, lipid profile is the first thing that is done. High cholesterol, people know how to read high cholesterol, people know how to read high LDL, and we quote that as bad cholesterol, HDL as good cholesterol. So can you talk a little bit more on those markers, what we should be watching for, and are those your favorite markers to track?
Yeah, so LDL cholesterol, as you said, so-called bad cholesterol, has been put forth as the primary risk factor for developing heart disease. And throughout my career, I noticed some troubling things. Many of the people who end up on my operating table do not have an elevated LDL cholesterol level. Now,
Wow.
some of these people are taking medications to keep their LDL cholesterol low. Some of them are not. But either way, if we are convinced that LDL cholesterol is the primary cause of heart disease, we shouldn't be seeing so many people ending up with advanced heart disease despite having, what's considered to be well-controlled or normal cholesterol levels. Once I became aware of the importance of metabolic health, one of the things that struck me is, of the measures of metabolic health, LDL cholesterol is not one of them. In fact, there are 5 standardly used metrics of metabolic health, and 2 of them are from the cholesterol panel, the blood work that everyone gets done. But LDL cholesterol, bad cholesterol as it's called, is not one of those metrics. HDL cholesterol, the good cholesterol that you mentioned, is one of the measures of metabolic health, as is your triglyceride level, another type of fatty acid that we measure in the blood on the lipid panel. And then the other 3 measures of metabolic health are your fasting blood glucose level, your blood pressure, and your waist circumference. So it turns out that LDL cholesterol does not have anything to do with metabolic health. Further looking into the risk factors for heart disease, what we see consistently in the studies is that having poor metabolic health, and this is oftentimes measured by looking at someone's insulin resistance. So how sensitive or how resistant their body is to the effects of insulin. But insulin resistance has been shown to be a much more powerful risk factor for heart disease than elevated LDL cholesterol. And yet, hardly any physicians mention metabolic health and insulin resistance or measure it, when their patients are coming to them to figure out what kind of risk they have for heart disease. And the other real powerful thing about metabolic health and insulin resistance is it's not only heart disease that it's been associated with. When we look at the top 10 causes of death in the United States every year, 8 out of the 10 of them are associated with poor metabolic health. So not only is this heart disease the number 1 killer in the United States every year, but many forms of cancer, Alzheimer's disease, chronic kidney disease, diabetes, high blood pressure, all of these conditions, as you go down the list, have been associated with poor metabolic health.
Yes, and there is no pill to fix that. We found a pill to fix. Again, that's just common practice. That okay, a pill will take care of LDL, and as you mentioned, it clearly does not, because otherwise they would not be on your operating table.
Yeah, certainly having reviewed all of the science around cholesterol lowering, with the use of medication, we see that the results of that have been fairly disappointing. Statin medications have been the number 1 class of medications prescribed worldwide now for the past 20 or so years. And we haven't really seen a major impact on the incidence of heart disease. As I said, heart disease remains the number 1 killer in the United States and worldwide. And that, hasn't changed to the degree that we would expect it to if, lowering LDL cholesterol was as powerful as we have been led to believe that it is.
Right. Yes, absolutely. And so, like you said, so folks, watch out for your HDL, your triglycerides, your waist circumference, your blood pressure, and your fasting glucose. That will tell you a lot more about your metabolic health, as Dr. Ovadia mentioned. And are there any non-conventional measures that you would like to tell everyone, which they are not, that is not routinely tracked, but they can ask their practitioners to order that, such that we know that they are in the healthy range?
Yeah, well, specifically when it comes to heart health, I think that, there is a test that is particularly powerful that is underused. There are really 2 tests that I would point to. One is a simple blood test that I believe should be part of everyone's routine examination, and that is your fasting insulin level. So Again, it's the amount of insulin that's in your blood when you haven't eaten for approximately 8 to 12 hours. This is different than the fasting blood glucose test that we do commonly get. And the
Right.
problem is that, you know, elevations in your fasting blood glucose level, which is one of the criteria we use to diagnose people with diabetes, um, occurs 10 to 20 years after your elevation in your fasting insulin level. So if we
Wow.
were to routinely check people's fasting insulin level, we could see it being elevated, and then we could take steps to reverse that. And that occurs much before we get to the point of having full blown, you know, type 2 diabetes and all of the end effects that come from having a chronically high insulin level. So that's the blood test that I recommend everyone ask their physician about. In terms of a imaging study to look at whether or not you have disease in the arteries of your heart, there is a test. It's called a coronary artery calcium scan. It's a type of CAT scan. It is very quick to do. Takes about
Hmm.
5 minutes.
Oh, wow.
You don't even have to have an IV put in, and in most locations you can get this test done for somewhere between 75 and $200 here in the United States. And that test will actually show you whether or not you have calcium building up in the arteries of your heart. And that is a very powerful predictor of whether or not you are at risk for heart disease. We know that people who have no calcium in their coronary arteries, a CAC score of 0, are at exceedingly low risk of developing heart disease in the following 5 to 10 years. So,
Okay.
for instance, if you're about 60 years old and you get one of these scans and your CAC score is 0, we know that your risk of developing heart disease over the next 10 years is about 1%. Um, and that is despite whatever your cholesterol level might be or anything else. So, again, I would much rather, instead of looking at blood markers and trying to sort of guess and read the tea leaves about whether or not you're, at risk for heart disease, I would much rather get the scan and see whether or not you have heart disease, so that we can then take appropriate action one way or the other.
That makes sense. Oh, right. And so going back a little bit on the fasting insulin levels, I know that that marker is not routinely checked, but if it is checked, like what numbers would you ask, would you tell people to watch out for? Because I've seen some crazy numbers, high numbers, some low numbers, but what would you consider an optimal range?
Yeah, so this is another, kind of key piece of information regarding this test, because most laboratories here, in the United States at least, report the normal level for a fasting insulin to be up to either 20 or 25,
25. Yes.
depending on what lab you get it checked at. In reality, I think for optimal health, your fasting insulin level should be under 10. It should be single digits.
Mhm.
And honestly, the lower the better. Um, and it is important, though, to pay attention to, both the insulin level and the glucose level, because we do see situations where people, with basically advanced type 2 diabetes, and certainly people with type 1 diabetes, have low insulin levels, but they have very high blood sugar levels. So the caveat is you need to make sure your sugar level, your glucose level is okay, and then you want your insulin level to be as low as possible, while maintaining a good glucose level.
Perfect, perfect. Yes, that's a really great advice because it's not really checked. And like you mentioned, typically it says 25, which is very misleading. So remember, people, it's a single digit is what you should aim for. Don't get misled by the 25 if you read that number on the range of fasting insulin. Awesome. So we know that more than 80% of Americans are not metabolically fit. That clearly shows that this is not a uh, not exercise condition, or it's not taking correct pills condition. It's probably coming from our diet and lifestyle. So this clearly probably tells us that we are messing something with our lifestyle. We are not eating right. So can you talk to what and where you found that what is the mistake people are making, what are they eating, and how did you do about you did it yourself, the transformation? So what helped you, doctor?
Yeah, so ultimately, when we look at really all of the dietary approaches that people use to obtain good metabolic health, they all have one thing in common, and that is they emphasize eating whole, real food and elimination of processed food. And, we can look at the vegan diet, we can look at the carnivore diet, and we can look at lots of things in between like keto and paleo and Mediterranean diets. And again, what we find in common is that the more whole, real food that you are eating, the less processed food that you are eating, the healthier you are going to be.
Right.
My journey started basically with eliminating sugar and process and carbohydrates in general. I went through a low carb and then keto type diet. Ultimately, I went to a carnivore diet about 3 years ago, and I've ended up maintaining the carnivore diet just because it works best for my lifestyle and my preferences. But that
Mhm.
doesn't mean that the carnivore diet is the right diet for you and for everyone out there. Um, it's ultimately up to each person to figure out what is the best approach for them. But the commonality is that you have to prioritize eating whole, real food. And I describe that as the things that grow in the ground and the things that eat the things that grow in the ground. So these are going to be your plant products, these are going to be your animal products, and they should be, you know, simple, easy to tell what the ingredients are in the food
Exactly.
that you are eating. If there is a big long ingredient list, if it comes in a package or a box, it is not going to be beneficial for your health.
Yes, exactly, doctor. And the label, the longer the label, that should be a sign that that's not real food. So if we can get everyone to eat real food, meal planning, meal prepping, do whatever you can, but eat real foods is the message to be metabolically fit and metabolically uh, healthy. So you mentioned that you have tried different diets. What are your thoughts on keto? Because I see so many people are curious and they have been on this roller coaster diet. What are your thoughts on keto diet?
Yeah, I think ketogenic diets can be a very powerful tool for people who are not metabolically healthy, that are trying to get metabolically healthy. Clearly, once your body has become insulin resistant, or has started down that pathway of insulin resistance, the more carbohydrates you eat, the worse it is. So, lowering carbohydrates and the ketogenic diet, or, I like to say ketogenic diets in general, can be a very powerful tool for doing that. The problem I see is that, the ketogenic diet has kind of become hijacked by the food industry. And so they make a lot of processed junk food that
Mhm.
they label as, keto foods, because they substitute, sugar substitutes instead of the sugar, and they use almond flour instead of wheat flour and all these other things. But it's still processed junk food. So that can be a big, sort of snafu in people who think they are eating, healthy things because it says it's keto, and the ketogenic diet has been promoted as healthy. And again, a ketogenic diet constructed from whole real food, I think, is a very powerful dietetic approach to help people with metabolic syndrome and to help prevent the metabolic syndrome. But like with any other diet, with any diet plan, you do have to be careful of claims that are made on packages and things that the food industry is putting out there when you adopt these dietary strategies.
Yes, absolutely, doctor. And so, like you said, the key is not following any particular dietary pattern. Find a diet that works for you, but just get off sugar, get off processed foods, and probably that might be the right metabolically fit diet.
Yeah, I think those are good starts for anyone who is not metabolically healthy, and is a simple framework to kind of start your journey and to figure out what ultimately is going to work best for you.
Absolutely. And in the book, I liked reading. So can you elaborate a little on that note? So you mentioned that substitute, don't eliminate in the book. So what's the thought process behind that, doctor?
Yeah. So again, in the book, I don't give you the Dr. Ovadia 28-day diet plan. You know, as I said, what works for me is not necessarily what's going to work for you. And quite frankly, even what works for you at one point in your life may change, due to a whole host of factors. So it's important to experiment, to, figure out your own best diet. And I think the best way to do that is within the framework of metabolic health. So if we use those 5 measures that we talked about of metabolic health, if we're looking at our fasting insulin level and other markers that can be useful, then we can use those to judge whether the changes we are making are, having positive effects or not. And if they are, great, stick with it, kind of tweak it as you go along to make it fit best in your life. But if it's not, you need to step back and say, okay, I'm going to try something else. And, again, just because some person, some influencer, maybe even some, healthcare practitioner is telling you that this is the best diet, if it's not working for you, if it's not improving your metabolic health, then it's not the best diet for you. And you just need to keep, searching to find out what is the best diet for you. And so I tried in the book to give many examples. As I said, I literally discuss the vegan diet, the carnivore diet, and lots of things in between. And I tried to give people some pointers about what can be metabolically healthy about each diet and what may not be metabolically healthy about each diet, so that they can then, start to work within that framework and figure out what's going to work best for them.
Awesome. Yes, that's a very valid point, doctor. And lastly, let's talk about, like, yeah, we spoke about diet and what people needs to be mindful for. The second aspect that many of the clients that I work with, they think that if they are going to exercise 5 days a week in the gym, then they are metabolically fit, and then they go home and they are like, okay, I worked out in the gym, so I can eat whatever I want. So what do you recommend from exercise point of view? Is there a particular exercise form that you recommend?
Yeah. So, first of all, the commonly, the common adage that you can't outrun a bad diet or you can't out exercise a bad diet is very much true. And if you are not eating foods that are supporting your metabolic health, it is very difficult, probably impossible, to compensate for that just by doing more exercise. In terms of the types of exercise that are most useful for supporting your metabolic health, clearly resistance exercise, exercise that are going to build and maintain muscle, are the most important exercises to be doing, because we know that the better that you are able to build and maintain muscle mass as you get older, the longer you are going to live, the better quality of life you are going to have while you're alive. And, muscle is the most metabolically active tissue. So the more muscle you have, the more energy you're going to be burning just at rest, let alone with your activities. And muscle is also a place where the body can store some excess energy, for use later on. So specifically, some of the sugar that's in our bloodstream can be put into our muscles in a form we call glycogen. And then when you start, doing something demanding, that glycogen can then get pulled back out of the muscles and used for a quick, immediate energy source. So that's why I always try and get people to prioritize resistance exercises. These can be body weight exercises, things like push-ups, pull-ups, and squats. These can be, weightlifting exercises, and there are a whole other, a lots of different options like resistance bands that can help you with a muscle building and muscle maintaining program.
Perfect. Yes. And like you said, you cannot outsmart your way with a bad diet. You cannot go away with an exercise. You have to find a form that works. And like Dr. Ovadia said, resistance exercise is probably the best way to go about doing it for your metabolic health. And if I were to summarize the session today and have like three key takeaways from what I understand, Dr. Ovadia, I feel like if people are tracking they can change what they can measure. So if they are going to track their HDL, if they are going to track their triglycerides, if they are going to, if they are in doubt, get a calcium score, and if they are going to do that, that is the number one thing that we can do to identify, and fasting insulin to track if you are metabolically fit or not. The second pointer that I love what you mentioned was eat real foods, take out processed foods and junk foods, and sugar, but bring in real foods, and that is what will help you stay metabolically active. And do not go behind diets, because that is not the purpose, or that is not going to get you anywhere. And from lifestyle and exercise point of view, said if you are sedentary for the whole day, just going to the gym for 30 minutes is not going to work it out. But definitely bringing in not just aerobic but resistance exercise is what will help you. So I love those three pointers, which I feel like will really help people get fit and will not come to you on your operating table. They'll come to you for more advice, but hopefully they'll not have to come to your operating table.
Yes, I certainly hope so. And, I invite everyone to check out the book. It's called Stay Off My Operating Table, and it's widely available on all of the usual platforms.
Will do. And I'll put the Amazon link in the comment section below. And folks, if you have any questions, make sure you put it in the comment section. And please, if you're watching it afterwards, please put in replay in the comment section. So that will help with the algorithm, and it will help us get this word and this message out to more people, and it will help everyone. Thank you so much, Doctor, for your time, and hope to see you soon on another podcast or on another platform. Best of luck.
Thank you, Niti.